Hi there. Before we get started, here's a quick note from the Wellbeing Project. Today's episode of At the Heart of It features some conversations about mental illness and violence. Listener discretion is advised. Let's get into the episode. Welcome to At the Heart of It, a podcast where we explore issues at the heart of social change and their solutions. We're on a journey inwards, going into ourselves, reflecting on who we are, listening to humanity's collective story. Our guides are the visionary leaders, activists, scholars, and practitioners who are changing the world and whose own inner journeys of well-being inspire their well-doing. Today's guest is someone who has dedicated her life to making Bangladesh a safer, healthier, and more inclusive place for everyone. Monira Rahman is an award-winning Bangladeshi human rights activist and Ashoka Fellow. For more than 30 years, she has led efforts to transform social behaviors and reform government policies around violence against women and mental health in Bangladesh. In a conversation live from the lush green gardens of Bangla Academy in Dhaka, where Monira hosted the first regional Wellbeing Summit in Asia, Monira reflected on her life's work and how well-being has inspired well-doing in her career. She has been an advocate for caring for oneself and for others, and today she's sharing her story and inviting us all on a journey of well-being. Let's get to the heart of it. Hi, Monira. Welcome to the podcast. Thank you so much for joining us.
Hi, Madeline. I'm very happy to join with you.
So, Monira, we are here in Dhaka, Bangladesh. You are an internationally known, award-winning social change maker. So tell us a little bit about your work and what you've been doing in Bangladesh.
Well, from my childhood, actually, I knew that there are inequality, injustice, and especially for girls and women in this country who are suppressed, oppressed, and their rights are not acknowledged, they're not respected. And in that way, I started to find out what can be done or what is the solution. First, begin with myself to liberate myself from these limitations. And it's quite unusual for a Bengali girl, young girl, adolescent girl of 13, 14, going out and doing things on her own. So it was not that welcomed by my family as such. But my mother was always encouraging me to be educated and be independent. She was always inspiring me to work for the community, work for the people, serve for the people. So I was involved in many different kind of activities, activism for human rights, especially for education for all. When I was studying in Dhaka University, I was elected vice president of one of the female hall, and that was quite rebellious, I should say, because there was military rule and therefore students movement was suppressed even by the law enforcement agencies. So it was very difficult time, but we really worked together and we got the democracy back. And I did my master's in philosophy from Dhaka University. And my first job was with Concern Worldwide as a social worker. I was 24 and in a village where the government has a institution called vagrant home, that means homeless people living on the street. Police sometimes put them in these institutions in the name of rehabilitation. So it was a center accommodating 700 women and girls. And my first day was very, very striking. I saw a girl was tied in her hand back and lying on the feeder street looking at the sun in a very hot, humid day. And I just untied her, and then it was a big issue for the institution authority
And why was she tied?
because it was a way of punishing someone. So I was called by the authority, but I answered them that I think any human being will untie. Why not? So they couldn't throw me out from the center. And then I found a Jomindar building, that means it's a very old building. It's an abandoned building, very damaged, no light. And there were hundreds of women there. And the authority said they are all mad people. And Concern told me that I have to work with them. So it was 1992. There was no mental health support services in the country. I didn't have any mental health background. I didn't know what to do, how to support them. So I was looking for any model, any organization doing anything about mental health in the country. For the first time, I came to know about psychosis, neurosis, depression, anxiety. So then I found one organization working with children with intellectual disability. So, by observing their work, I found something quite interesting. I bought some postcard, paper, color pencil, and then I was just sitting in that Jamindar building and just seeing how the women respond. So, after 7 days, some of them came to me, nearer to me.
You were just sitting there and no one was approaching you, no one was talking to
No,
you. They
no,
didn't want to come.
yeah. And then I found some people were started to pick a particular type of postcard, and then I found that maybe that has a connection with them. So I started working on those areas with them, and I really would like to talk about one story that struck me and actually changed my perception about mental health. So this woman called Rokia, she was a teacher of a village from Kishorganj. Her husband was also a teacher. And in 1974, in our country, there was a huge famine. So the relief was coming through the school, and the head teacher was stealing the relief goods. And Rokia saw that, and Rokia was raising her voice against the head teacher. Head teacher was not happy, and the head teacher said, Rokia has become mad. Rokia is mad. Rokia was trying to prove that she is not mad, rather, this man is actually corrupted. But no one knew her, a village woman not supposed to raise her voice like that in public. So she was held and tied, and she was taken to the psychiatric department. And when she was coming, she thought she will complain to the education minister about that teacher. But when she was under treatment, under medication, she lost her consciousness. At one stage, she actually went out of the hospital. No one knew about that. She was on the street for several years. She can't say how many years, but she was raped there. She had a baby. Baby died, and then she developed this psychiatric illness. At some stage, she was taken to this institution. When I found her, she had bipolar mood disorder, and she had severe mental illness. Then I invited some of the psychiatrists for their assessment, and Rokia started to receive medication, and she was responding so well. She told me about her story. So I knew that she was a teacher. So I created a creche facility in this institution, and I appointed her as a creche facility teacher. She was very happy. And then she said that I would like to see my daughter. So we took a permission from the authority, took her to that village, but her husband didn't accept her. They didn't allow her to see her daughters. Her own family didn't take her, so she had to come back. She relapsed. Her treatment started again. So my question at that time was, who is responsible for Rokea's mental health and why it is happening? Or if someone experienced this sort of mental illness, then how to support them? Because at that time, there was only Pabna Mental Hospital, and in Bangla, that means Mads People Jail. So people were taken there and tied and caged, and treatment was only medication. And it was very difficult for me to find any solution locally because there is no other model. So I actually created some livelihood options for these girls, these women who were staying there. And I have seen that when we actually engage them, in addition to medication, When we engage them in activities, a purposeful activity, when they create something for them or for others, when they're actually supporting each other, then that actually helped them a lot to going back to normal life. So I'm talking about 1992 to 1999. I was responsible for 7 centers in Bangladesh. I tried to create a model there that can help them in their rehabilitation. And then my life changes again. In 1997, I met a survivor of acid attack. I was horrified. I was shocked. I couldn't understand what happened.
Can you tell us a little bit about, very briefly, the history of acid
Well,
violence in
acid,
Bangladesh?
yeah, acid is a very corrosive chemical, and it can not only destroy the skin, it can go very deep inside the bones and it can create permanent disfigurement. This problem started in late 80s in Bangladesh. The young girls were thrown acid by the young men who refused a romantic relationship or a marriage proposal. That acid was used by the perpetrator to take revenge. The man did that with an intention that if this girl is not mine, she will not be anyone else. And there was no awareness about this acid attack. Even I didn't know about acid attack.
Was it very taboo? As if
There
someone, if
was,
someone had been attacked, they did not want anyone to
mm,
know, and it
yeah,
was something that the family wanted to keep very hidden, and there was no justice and no,
yeah,
yeah.
there was more like the women were blamed for this act, like why you did something, why you raised your voice, or why you said no. So they were ostracized, and there was no treatment facility in the country. Therefore, they had severe disfigurement, which was also difficult for them. So it needs a holistic approach. It's not just treating them medically. When they go back to the village, then they are still ostracized by the community. They are not taken back to school. They thought that other people are horrified by seeing them. And then they become completely a burden of the family. And the treatment, the plastic surgery, reconstructive surgery, that takes long time, very expensive, over the period of many years. And only treatment facility was available in Dhaka, and there were only 8 bed capacity for all types of burn for 160 million people. So you can imagine how difficult it was for them. And then, because it's a criminal offense, they were under threat. So not only they are receiving the expensive treatment, economically they are suffering because they may have to sell whatever they have. They're going through the pain and all this surgery, but also they have to face all the threat, the whole family, because maybe they have filed a case against the perpetrator. So there was no organization in Bangladesh to support them, and government didn't have any services for them. There was no law to combat acid violence or providing the adequate services to the survivors. So Dr. John Morrison from UK and I started trying to find out what we can do. We established Acid Survivors Foundation in 1999. First, we concentrated on the medical aspect because it was the immediate need. We have to save life. We have to minimize disability. We have to ensure that they can go back home in a safer way. They need physiotherapy and other types of treatment protocols to actually get a better. But when we started working on the medical intervention, we found that actually this is not just the physical treatment, because every year we were seeing that some of the survivors, they ended their life, and at least 12 or 15 survivors were developing severe mental illness. We had to admit them in a specialized hospital for treatment. So we needed an intervention for their psychological treatment, counseling, and psychosocial treatment. And again, there was no psychological or psychosocial intervention in the country. I told you about 1992. I didn't find that. Now in 1999, I still searching for that. So in 2005, for the first time, we appointed a clinical psychologist
In
and
the Asset Survivors
in
Foundation?
Acid Survivors Foundation. We also by that time we started in a hospital, a 20-bed hospital, a 40-bed rehabilitation center, and we were bringing experts from the world,
It's a
and
huge,
it's a
huge
huge,
improvement.
yeah, it's a,
Small scale
yeah,
compared to 160 million people, but compared to what was initially there,
yeah. We
huge.
actually wanted to create a model. This activism created a national burn institute, and they incorporated burn and plastic surgery in the medical education. Earlier, there was no plastic surgery
That's
courses.
amazing.
So this movement also resulted in 2000 of having two laws, one for speedy trial of the perpetrator and one for banning the availability of the acid in the open market. And we also created committees to monitor the implementation of the law, and they created the fund for supporting the survivors. But then all were happening in the Dhaka city around the Acid Survivors Foundation. But when the survivors were going back home, there was no support services in the community. So we partnered with different organizations and connected with them, with those organizations, developed their capacity. We developed the psychosocial support providers at the community level. And most importantly, we developed many survivors as a peer support providers and a psychosocial support providers. So my mission was to bring down this acid attack. It was rising when we started. It was rising at the rate of 40% each year. And it rose like 500 in 2002.
Wow.
And then we had the law in 2002, and then it was coming down. So by 2012, it came down to 50 attack per year.
So
It
you brought it
was,
down 90%.
yeah,
Wow.
yeah.
Wow.
And then by that time, we have created this holistic model, that biopsychosocial model. So the legal support, the rehabilitation support, the medical support, all are working together. We started the prevention campaign. The celebrity joined us. The students came forward. There was a huge movement in the country. Media was hugely engaged in this campaign.
So, how did this experience start to get you to think about mental health and well being on a wider scale for everybody, not just for survivors of violence?
So that inspired me to thinking about what we need to do about mental health, because we all have mental health, but our mental health can be affected anytime in any way, and we need support for that. So that time mental health is governed by the Lunacy Act 1912 that considered these people are lunatic, they're harmful, they need to be institutionalized or
Kept
cased.
away and
Yeah,
can't be a part of society.
yeah. The people with mental illness, they are ostracized, having huge stigma around, no treatment facility, no holistic approach, no psychosocial support system, and no prevention work. There's no counselors in schools for the children. So then I thought, now I need to do something for mental health. By that time, I became an Ashoka Fellow, as you said. I'm a change maker, yes.
You were a change maker before you got the Ashoka, before
Yeah,
you
that's
became an
true.
Ashoka Fellow.
That's true. That's true. And therefore,
They just recognized you for
yeah,
all your
they
hard work.
recognized me
Yeah.
as a senior Ashoka Fellow, and this, enabled me to visualize what can happen, what can be done in mental health. In 2014, I started this Innovation for Wellbeing Foundation, because for the well-being, we know that there are people who are suffering from mental illness, but we can prevent that. Maybe we can reduce that number, we can limit that number if we are working on well-being. So if people's well-being are good, well-being means not only physical well-being, their psychological well-being, their social well-being, their spiritual well-being, their financial well-being, their emotional well-being, then we can say that then there is the resource to tackle their mental health situation in a better way. So we wanted to focus on well-being aspect, and mental health aspect and innovation, because there was nothing in the country. So what is the solution for Bangladesh? We cannot just bring something from the Western country.
And you think and well-being is a Western concept, or
Yeah, well, the solution, most of the services have developed in the Western country, especially for mental health treatment. So well-being, we have a lot of practices, but that was not considered well-being practices. So
so thinking about mental health, that was
yes,
growing. But
yeah,
then to really bring it together with the concept of financial, physical, spiritual, social, emotional, psychological health as well, as a holistic approach to well-being was not quite the norm or
understood,
understood, or
yeah,
yeah.
or not
Yeah.
practiced. So mostly mental health was considered as mental illness. Mental illness is not mental health. Mental health is my potential. Mental health is my ability to work for myself or for others, ability to manage, cope with my stress, and live a normal life. But when we consider that mental illness, then all this stigma come. That is,
And it's the flip side of a positive thing. It's an illness,
yeah,
so there's a negative
yeah.
connotation there as well.
Yeah, and language plays a very important role here. So, how we address these people who are suffering from mental illness, lazy or making up or not real, it is forever, worthless. So, all this kind of languages is actually
Judgment.
very judgmental, not only very judgmental, there is no hope, there is no possibility, there is no way to come out from this situation. So that scenario has to change. And that is also because of the law. When the law is saying it's lunatic, then people think the same way. So, first thing was for us how to change this law. So, Innovation for Wellbeing Foundation created a network called Bangladesh Mental Health Network, and this network started working with different sectors, including people who has experienced mental illness and their family members, to change this law. What should be the law? And we drafted an alternative law. And finally, in 2018, Bangladesh government passed the Mental Health Act 2018, which was much more accepting that this is a condition and there are also different types of solution. But still, it was much more medical model focused. And in medical model also we have to consider that whether this is a holistic approach, because it's not just giving the medicine, whether you are giving the counseling, whether you are giving follow-up services, whether from recovery to rehabilitation to reintegration, whether we are providing these services or not. And
Yeah.
there's no community-based mental health care support service system in Bangladesh. So our next challenge was how to create that model, how to create a model that will be much more holistic, much more applicable for different types of audiences. One size cannot fit all. Everyone is unique. So that was it's a huge area. So we try to focus on three main areas. One is obviously would like to integrate mental health support within the primary healthcare support service system. Then another priority we have is to introduce counseling, at least mental health first aid program in schools. By that time in 2015, we got the license for introducing mental health first aid program in Bangladesh. So that actually created a huge change because that increased the mental health literacy and also helped to reduce the stigma around mental illness. So now in 2024, I see quite a change in this field actually. We were only one organization who started working on mental health, and now we have many organizations who are focusing on mental health. We just finished this Wellbeing Summit, which is a kickoff actually to shake us and start a conversation. What is well-being solution for us? What is our country actually need to focus on? How can we support each other? I'm very happy that we had this summit. This is very special because now we have many actors in mental health field who are active and engaged to collaborate, to work together, to make a network, a platform for this well-being movement in Bangladesh. So we created that network through this Wellbeing Summit.
So, the Wellbeing Summit in Dhaka was the first regional Wellbeing Summit in Asia. Congratulations for that achievement. The theme was Projono.
প্রজন্ম থেকে প্রজন্মে, generation to
Yes,
generation.
and you
Yes.
were at Bangla Academy, a very important place for Bangladesh, a place to celebrate the Bangla language. And you had the people there from all areas of work, the youth to the elders. Tell us a little bit about how the event connected with the land, language, and life.
This summit talked about why individual well-being is important and why it is important collective well-being as well. We talked about how social resources around us are actually supporting our well-being. We talked about social and emotional learning. In Bangladesh, in a hierarchical society, it's a very male dominant society, very difficult to deal with your emotion, to express your emotion in a healthy way. So women suffer in silence. And men also suffer because, in a way, they are socialized. They cannot also express their vulnerability. So, what we try to give them a safe space here and have that conversation. What are the barriers and what are the opportunities? What is available actually? And what will be in our future well being agenda for the country? We don't have even a well-being strategy in Bangladesh. We have national mental health strategy, we have national mental health policy. That's good, but that is again talking about more after we are suffering. So I think this Wellbeing Summit is very unique in a way that created an opportunity for us, especially for change makers, to be together, share their experiences, and learn from each other. And also the therapeutic interventions, this art interventions, we have seen that how artists, the painters, or the singers, or all the other artists, how they actually engage these people, and
Well,
when this
it reminds me of you said the first thing you did with your work as a social worker is you
yeah.
brought the postcards and the coloring and the paper, and that
Yeah,
was one of the first ways you were able to
yeah,
engage with people
yeah.
in your
And
community.
I believe that because I have seen that with the survivors of acid attack, I have seen that with the homeless people, the sex workers, and many other marginalized communities that we work. Visualization is very important. Then sustainability. This is the challenge for Bangladesh. We are from Delta and we have very fertile land, but also it's very prone to disaster. And therefore, it's very important that we connect this land, the fertility with well-being. Well-being always give that fruition that brings something meaningful in our life. And then also with disaster, we have resilience. We build our resilience. Life has adversity. It will continue like this. But the resilience that we are creating and the way we are supporting, the whole nation is supporting each other, that's the model. How to help themselves and in their daily life, how to create a safe space, how to live without fear. Fear is a big issue, limiting us. So it's very important that we can actually win this fear. So all these tips and tricks and fun and all these things, I think is all together. I feel like it's created a new energy.
And with new energy, what is coming next? Or what needs to come next, or what do you see already emerging?
Yeah.
What do you see for the future of this? Because when we talk about well-being for social change, it's well-being in two ways: well-being, a culture of inner well-being for change makers, but also in change making. So normalizing the concept within social change, which is already there, but maybe just knowing that a bit more concretely, and also within the social change sector. So change makers and organizations have those structures in place to encourage that. What do you think is coming next in Bangladesh?
Yeah, it's important to create a model that can be replicated for the whole country. It has to be cost effective. It can be done with whatever existing resources available, and it is received by the people. What is their aspiration about the next step? It's important to continue this conversation. Maybe we will start small, as it's like Survivors Foundation. We started with a small thing, but that created, I told you, that the National Institute for Burn and Plastic Surgery. And now we have changed the law for mental health from the Lunacy Act. Now we have the National Mental Health Policy, the strategy paper. And obviously, one size doesn't fit everyone, but it has to be from within our local cultural context, the social structure, and the human resource that we have. And I believe that everyone has that capacity, the resources, the ability. We just need to create that opportunity for them. And if we are able to educate and train people, they will be a great resource for the community. And that might be the solution for Bangladesh.
Monira, you have told us about your work, you have told us about your career, about the amazing things you've done, the changes that have been taking place in Bangladesh. You've told us about your impressions from the Wellbeing Summit Dhaka. And my last question, you mentioned a few things as you were explaining to us about your work and starting from your times in university to your first role as a social worker, then through the Asset Survivors Foundation, now with Innovation for Wellbeing Foundation. Under all of that, at the heart of your work as a social change maker, what is your motivation, your inspiration, your dream, your message to the world? What is there?
We all are connected wherever we are and whoever we are and whatever we are doing. It's very important that everyone is content and happy and living the fullest of their potentials. And also, we work as a community, the aware community, and by collaboration, by working together, by supporting each other, we can actually advance much more. We can progress much more. We can do much more for ourselves as an individual, for our family, for our community, for the planet. So this is my aspiration, that we really need to looking at ecological belonging, and we need to connect to the life and the planet together.
Well, thank you so much, Monira, for speaking with me today live in Bangladesh. It's been a true pleasure. Donyabat. Hope I said that correctly today.
Yes, yes, yes. Very well said.
Donyabat, and we'll see you soon. Thank you.
Thank you. Thank you, Madeline.
Thank you for listening to this episode of At the Heart of It. For more news, research, and stories about well-being and social change, visit wellbeing-project.org. The Wellbeing Project is the world's leading organization advocating for the well-being of changemakers and for well-being in changemaking. We believe well-being inspires well-doing. Thanks for listening, and see you next time.